Hey everyone, and welcome to today's Explainer. Today, we're taking a really fascinating journey into a topic that, honestly, can seem pretty intimidating at first glance: bone tumors. But you know what? By the time we wrap up this explainer, we're going to completely demystify the subject. We're going to turn what might feel like a scary medical mystery into a totally clear, structured, and logical sequence of facts. So, let's get right into it.
Okay, let's dive into this. Here is our step-by-step roadmap for today. We'll start with understanding bone tumors, move into benign versus malignant tumors, then recognizing the symptoms, diagnosing the condition, and finally, targeted treatment strategies.
All right, Section 1, Understanding Bone Tumors. Now, before we get into all the different types and the high-tech treatments, we really need to establish the physical reality of what we're actually talking about when we use the word tumor in the context of your bones. A tumor is fundamentally just a mass or a lump of tissue. It forms when cells in your body start dividing abnormally and uncontrollably. And as this mass grows inside the bone, it starts physically displacing your normal, healthy tissue. Now, I want to reassure you right off the bat, while the idea of abnormal cells displacing healthy tissue sounds alarming, understanding this basic structural problem is the very first step to fixing it. It's a physical issue, and as we'll see, we have some incredible physical solutions for it.
Moving right along to Section 2, Benign versus malignant tumors.
So, the crucial point is establishing the critical difference between these two categories, because this is where a lot of that initial anxiety really starts to melt away. Benign tumors are non-cancerous. They typically stay exactly where they formed, and while they're highly unlikely to be fatal, they can grow and compress your healthy bone tissue, which is why they still need medical attention. On the flip side, malignant tumors are cancerous, meaning they have the dangerous potential to spread throughout the body. But here is the most reassuring fact to keep in mind. Benign tumors are far, far more common than malignant ones.
Let's actually zoom in on those benign tumors for a second. According to the American Academy of Orthopedic Surgeons, osteochondromas make up between 35 and 40% of all benign bone tumors. These are essentially an abnormality of growth made of bone and cartilage, and they usually form near the actively growing ends of long bones, think arms and legs, specifically in adolescents and teenagers. But there are several other really fascinating benign types too. For instance, we have the non-ossifying fibroma, which is super interesting because it's considered the only true cyst of bone, and it's mostly found in kids and adolescents. Then you have giant cell tumors, which actually grow aggressively in the rounded ends of bones, usually in adults. We also have enchondromas, which are cartilage cysts growing deep inside the bone marrow, and conditions like fibrous dysplasia, where a gene mutation makes bones weak and vulnerable to fractures. Oh, and there's even the aneurysmal bone cyst, which isn't really a tumor, but rather a rapidly growing destructive blood vessel abnormality.
And this brilliantly illustrates the malignant side of things. When we talk about primary bone cancer, meaning cancer that actually originates right there in the bones, data from the National Cancer Institute shows it accounts for less than 1% of all types of cancer. Literally less than 1%. It is exceedingly rare.
Now, when primary bone cancer does occur, it generally falls into one of three main buckets. First up is osteosarcoma. This affects kids and teens, mostly around rapidly growing areas like the knee or the shoulder. And interestingly, it's been linked to high doses of radiation from previous treatments. Second is the Ewing sarcoma family of tumors, or ESFTs. These tend to strike adolescents and young adults right in the medullary cavities. That's where your bone marrow is produced. And a really intriguing demographic fact from the NCI here is that African American children very rarely develop ESFTs. Finally, there's chondrosarcoma, which typically strikes middle-aged and older adults in places like the hips, shoulders, and pelvis.
Because primary bone cancer is so incredibly rare, most bone cancer is actually what we call secondary bone cancer. This mostly affects older adults and means the cancer actually started somewhere else in the body and then hitchhiked its way over to the bone. The most common primary sites that end up spreading to the bone are the kidney, breast, prostate, lung, and thyroid gland. And the most common type of secondary bone cancer overall? That's multiple myeloma, which shows up as tumors right inside the bone marrow. Which brings us to Section 3, Recognizing the Symptoms.
You know, the true underlying causes of bone tumors mostly remain a huge mystery. Aside from a few connections to genetics, prior radiation, or maybe past injuries that were repaired with metal implants, doctors just don't always know exactly why they form. And because the why is so unclear, recognizing the physical warning signs is absolutely crucial. So what should you actually look out for? Well, the most common symptom is a dull ache in the bone that gradually becomes severe and constant, sometimes even waking you up out of a dead sleep at night. Another major red flag is something called a pathologic fracture. That's when what seems like a completely minor, harmless injury suddenly breaks an already weakened bone. You might also notice some swelling, actually feel a new mass of tissue, or get random night sweats and fevers. But get this, a lot of benign tumors have absolutely zero symptoms. Sometimes they're only discovered completely by accident when you get an X-ray for something else entirely.
All right, let's switch gears to Section 4, diagnosing the condition.
So, if symptoms do pop up, how do doctors actually figure out what's going on? It turns out hospital procedures are basically just highly logical detective work. And this detective work usually starts incredibly simply, with blood and urine tests. The lab is basically hunting for specific proteins that act as clues. A major clue is found using the alkaline phosphatase test. See, alkaline phosphatase is an enzyme. And when your bone tissue is highly active, like when a tumor is rapidly churning out abnormal bone tissue, large quantities of this enzyme dump into your blood. It's a fantastic early warning sign, especially for adults who have already stopped growing naturally.
From there, doctors crack open their medical imaging toolkit. They'll almost always start with standard X-rays, but then they frequently move to a CT scan. A CT scan takes a whole series of detailed X-rays from multiple different angles, which acts like a 3D map to help doctors pinpoint the tumor's exact size and location. Next in that toolkit is the MRI scan. Now, instead of X-rays, an MRI uses powerful magnets and radio waves. This gives doctors an incredibly crisp, detailed picture not just of the bone itself, but of all the soft tissue surrounding it. It ensures they know exactly what muscles or nerves the tumor might be messing with. To really round out the imaging phase, they might use a PET scan, and the science behind this is just wild. For a PET scan, they inject a tiny amount of radioactive sugar right into your vein. Because cancer cells are growing out of control, they are super hungry and eagerly consume way more glucose than regular cells do. By tracking where that radioactive sugar concentrates, the scan vividly lights up the exact location of the highly active tumor cells. It's like a glowing beacon for doctors.
Let's move on and see how this builds, because while imaging is fantastic, a biopsy is literally the only way to be 100% certain of what we're dealing with. The word biopsy sounds intimidating, but it really just involves 3 logical, straightforward steps. Step 1, you're given local or general anesthesia so you won't feel a thing. Step 2, the doctor removes a tiny sample of the tissue either through a simple needle or a small incision. And step 3, that tissue gets sent to a lab for microscopic examination. That's the whole shebang. 3 logical steps to confirm exactly what the enemy is.
And finally, Section 5, targeted treatment strategies.
Once the doctors know exactly what they're dealing with, we enter the final phase of targeted treatment. This is where our story reaches its really reassuring conclusion. If your tumor is benign, your doctor might literally just suggest watchful waiting with a few periodic X-rays, or a simple surgical removal so the bone doesn't fracture later. But if it is malignant, the entire game plan hinges on the stage of the cancer. Is it localized, meaning it's strictly confined to the tumor and its immediate area? Or is it metastatic, meaning those cancerous cells have already broken away and spread to other parts of the body?
Based on that staging, doctors deploy some pretty amazing main strategies. Surgery is the standard approach, where they carefully cut out the tumor and its margins. But surgical techniques have evolved so much. Doctors now frequently use limb salvage surgery. This is a real game changer. Instead of amputation, they can successfully remove the cancerous bone, replace it with a high-tech metal implant, and completely save the patient's tendons, muscles, blood vessels, and nerves. It's incredible. They also utilize radiation therapy, blasting the area with high-dose X-rays to shrink tumors before surgery, as well as chemotherapy.
Now, chemotherapy uses powerful anti-cancer drugs to actively hunt down and destroy those rapidly growing cancer cells, which is especially critical if the cancer has spread. And yes, it absolutely comes with known side effects, things like nausea, irritability, hair loss, and extreme fatigue. But I really want to emphasize here that advances in chemotherapy have massively improved survival rates. New, highly targeted anti-cancer drugs are constantly hitting the medical scene to help mitigate those exact side effects and dramatically boost recovery.
But get this, the innovation absolutely does not stop there. Take a look at this incredible modern alternative to regular surgery, cryosurgery. In this treatment, doctors literally insert a hollow tube directly into the tumor and pump in liquid nitrogen or argon gas. They kill the cancer cells by freezing them to death. It is a remarkably precise, minimally invasive way to stop bone tumors in their tracks.
Now, what's really interesting here is looking forward. When you think about how far we've come, from diagnosing hidden tumors with glowing radioactive sugar to completely replace diseased bones with metal implants while saving a patient's entire limb, or, literally freezing cancer cells to death, the progress is just staggering. With all these rapid advancements in limb salvage, cryosurgery, and targeted therapies, how will the future of medicine continue to reshape recovery for patients worldwide? It's a question that leaves you feeling incredibly empowered and inspired by what medical science can achieve. Thank you so much for joining me on this structured deep dive. Keep learning, keep asking questions, and I'll see you in the next explainer.